Hi guys, it's Mallory. For my skill, I'm going to teach you guys about ostomy care. So I'm going to go over assessment of your ostomy appliance, and how to put it on, and how to empty out your ostomy bag. First thing about ostomies to know, they're not as scary as you think they are. I know a lot of people get freaked out by them. They just make them nervous. Patients, nurses, if you don't see them a lot, they make people uncomfortable. And I'm here to tell you, really not that much to it. So first thing we're going to do is gather our supplies, because there's nothing worse than being in the middle of changing an ostomy appliance and not having something. First thing you're going to need is a patient with an ostomy, or a handy dandy little fake stoma thing. Well, I've got the stomas here. Let's talk about stomas. I've got two different shapes here, and they are actually two different shapes and sizes for two different reasons. This is usually about the size of an ileostomy. It's smaller because it's in the small bowel. The output of your ileostomy tends to be more watery because it hasn't gotten to the large bowel where you do the water reabsorption. So your ileostomy output is going to be more watery. The larger stoma here is generally what you see with the colostomy. It's larger because it's from the large bowel. Your output will be thicker. The consistency and the thickness of your output is going to depend on where along the large bowel it is. So a colostomy that's in your ascending colon is still going to be thinner than a colostomy that is on the descending colon, because as it goes around the tract, more water gets reabsorbed. When you are assessing your stoma, you want it to be a nice, moist, beefy red. When to notify a provider: if you start your shift and you have a nice, beefy red stoma like this, and then you go to reassess or empty, and suddenly your stoma is pale or dry or dusky, maroon, purple, black, all of these colors are bad colors when it comes to stomas. You want to call your provider immediately. If you come into work and on your shift assessment, your stoma is not a nice beefy red, make sure your provider knows that. Maybe that's the patient's baseline and we're watching it. Maybe it's a new development. But nice, beefy red and moist. Those are our signs that our stoma is getting enough blood flow. So, ileostomy, watery output. Colostomy, thickness varies on its location in the large bowel. There. You need a stoma. Here's your stoma. Set it off to the side. Next, you need your appliance. There are many different types of appliances. For this case, I have got a two-piece, so a wafer and a bag. In my practice, this is personally what I prefer, but I don't actually have an ostomy, so my preference doesn't really matter. But I get to decide what to do here, so I've got the two-piece, wafer and bag. Another thing that's always good to have is a backup, because if you bring two, you'll only use one. If you bring one, you'll mess up and need two. Always. When you've got a bag and a clip, make sure you've got your clip. Important thing to remember about your clips: there is one clip for every box of bags. So, in your box of bags for your ostomy supplies, there is not a clip per bag. There's a clip per box. That makes this little guy worth gold. Always, always, always make sure you know where your clip is. If you are switching out an ostomy appliance, you're just changing it, whether you're changing the bag or you're changing the whole appliance. Before you dump your bag, take your clip and put it somewhere where you can see it. You learn nothing else. Learn to value and treasure your clip. Alright, some take my clip, put it right there. You're going to want your stoma paste, something to cut your wafer to the size of your stoma with, skin prep. I've got cotton tip applicators for a fun little trick that I use, something to mark with. So, let's get this party started. In each box of wafers, there comes a transparent wafer. Basically just this part that's transparent, so that you can make a template of your stoma, and you can use that to cut out your wafer every time. I don't have one, so we're winging it. Rule of thumb when you are cutting out your wafer, start small. You can always make your hole bigger. You can't make your hole any smaller. If you make your stoma opening too large, you're going to be exposing a lot of the peri-wound skin to the stomach acids that come out with your output. If you make it too small and it fits too closely to your stoma, that's also not good. You can cut off circulation. You can cause a mucosal separation. So you want your wafer to fit about like a centimeter border from your stoma. So I'm going to get to cutting and measuring. We're going to use the colostomy. Here we go, and we cut. As always, your hand hygiene, because you're getting ready to work with somebody else's bodily fluids. Glove up. Get to measuring, get to cutting, and make your perfect little output. Here we go. So we're not right up against our stoma. Now we're going to prep our skin. You just gotta take soap and water, clean up around the area. You don't need to worry about cleaning the stoma. The stoma is acid proof because it is the inside of your bowel, which is acid proof. So you don't need to scrub all the way up to it. You just kind of scrub close to it. Next thing you want to do is your skin prep. Just a non-sting barrier. Kind of prep up your area. Same thing. And in the trash. Stoma paste. Now, if you're really good at eyeballing things, you can apply it directly to the skin. Other way is to put the stoma paste directly on the wafer. And also, this now transparent, you can put it to the side and keep it, and there's your template for your next wafer. So, now we just apply. Pasted. This is where my little trick comes in. This isn't a necessary thing, this is just something I do. So that you can control where your stoma paste flails out when you stick it to your actual person. Just take a cotton applicator, just wet down the tip. Not all gloopy. Kind of more evened out. The reason you wet your cotton tip applicator, if you use a dry one, your paste is just going to stick to it, and then you're going to be having a mess. All right. Okay. We take our bag, take our clip, fold the bag over once. You're going to listen for a snap. It's not snappy as I want to say. Only fold over once. Some people think that if they fold over twice, if they kind of like triple wrap it like that, you know, there's more coverage, it's going to be better sealed. That is actually not going to work. The clips are designed to clip and secure one level of plastic. So any more than that, you put too much for the clip to handle. One layer of plastic. Make sure you got a good clip. And we're going to put on our bag. And it just goes in the grooves. And you're going to snap it. And listen for your clicks. If you don't make sure you hear your clicks, you're going to have something, all right? And then you're going to have your patient take it, and they're just going to sit there and put their hands on it, and that heat from their hands is going to activate our adhesive and make it stick. I'm just going to hang out, and there you go. You have applied. Your patient now has a nice, pretty ostomy appliance to their ostomy. Step one done. We're going to work on emptying an ostomy. For this, you need graduated cylinder to capture and measure your output, gloves, damp paper towel. First step always is to perform hand hygiene. So you want to empty your ostomy bags when they are a third of the way full, halfway to third. You don't want them to get any more full than that, because as you can see, it will start to get heavy and it will start to pull. And as it pulls, you can start pulling your wafer away from the skin, which is going to create leaks. You increase your risk for just having blowouts. So halfway, 2/3. There we are. Here we're ostomy. It's going to get interesting. I don't have anyone to hold it for me. Okay. So, grab your cylinder. Put it where you can aim it. Take your bag. Kind of aim it up towards you. Clip. Remember, this is gold. Don't lose it. Put it right where you can find it. And you're going to take your end, and you want to fold it back and create a turtleneck. That's what this is called. And this is just going to help this is going to make keeping your bag clean and a turtleneck. Right like that. Okay? And then you take it. And here we are. We have our emptied ostomy. Take your graduating cylinder, set it off where neither you or your patient can knock it over. It's happened. This is where the if your clip has got anything on it. There's still some residual goo. Wrap the towel around your finger. That is on the hanging, the exposed part. So this part, really want to make sure that this part of the bag gets nice and cleaned, because that's the part that's exposed to air, and that's the part that's going to leave residual odors. Take your bag, fold it over your clip once, just once, no more than once, and feel for your clip. It's more of a feel than a hear. There we go. Voila, they're done. Take your output. I got about 300 of brown ostomy output. I'm gonna dump it, chart it, throw away your gloves, and hand hygiene again. There you are. You should now be able to assess your stoma, apply your stoma appliance, and empty your stoma bag. Just as easy as that. Told you it wasn't scary.